My name is Dr. Douglas Swan, and I am a board-certified spine surgeon and also regenerative medicine specialist. But you may wonder, what the heck is a spine surgeon talking at the Veggie fair? But I'm here to talk about, through my experience, 14 years of experience of taking care of patients in surgery, also doing stem cell therapies. I've seen a lot of patients and seen how they recover. And I'll share with you some of my experiences, okay? Okay, the mic is not working. Can you hear me?
Yes.
Can you hear me back there? Put it up. A speaker? Okay, we can try that. Is this better? No, not really? Okay, I think that's going to be as good as it gets. So if you're in the back, then if you can't hear, come closer. You can sit on the grass. So, all right, I'll try to talk louder over the airplane, so hopefully you can hear me. Okay? So I started medical practice 14 years ago. I trained at University of Texas medical branch. And then did my orthopedic surgery residency in St. Louis, then went up to Michigan and did my spine surgery fellowship, and it was way too cold, so I came back home to North Texas. Okay? And this is what I learned how to do, to reconstruct spine surgery with the big open back surgery. But I knew that wasn't the best way, and I wanted to make it better, and devoted 14 years of doing minimally invasive surgery and discovering, inventing a lot of the laser technology to do spine surgery. But then I also moved on to stem cell therapy, and especially with the stem cell therapy patients, it's critical to decrease their inflammation and then increase their anti-inflammatory effect. And the whole food, plant-based, vegan diet is the best way to take care of these patients. But one thing you'll notice is this. Look around the North Texas and you'll see a lot of different hospitals. And hospitals are getting bigger and bigger. As you saw in the previous slides, the incisions are getting smaller and smaller, and technology is advancing at a significant rate. But why is it that our hospital is continuing to get bigger and bigger? The Heart Hospital in Plano is a great hospital. However, over the past 10 years, they've done $500 million worth of expansion to take care of the heart disease, which is completely preventable and also reversible. So this is what most doctors and healthcare is doing. This is a picture of the current healthcare system. It's more like a sick care system. Okay? So doctors are just mopping up the floor of overflowing sink. Okay? And then somebody's got to turn up the faucet, and only one who can do that is yourself. Okay? You're the only one with the control, complete control of your own destiny, and you're the only one who can turn off the faucet. Okay? So 1 out of 4 of you will die, unfortunately, from the heart disease. That is the statistics. Okay? And it doesn't have to be that way. And 2 out of 5 of you will be diagnosed with cancer, some form of a cancer, in your lifetime. Okay? And 50% of you, either this half or that half, will be diagnosed with diabetes or will become pre-diabetic by year 2020. That's only almost a year away. 50% of the Americans will be diabetic or pre-diabetic. This is complete crisis. Okay? So we're spending about $3.5 trillion a year in healthcare or sick care. Okay? And 75% of it is due to chronic illnesses, which are completely preventable and reversible. Okay? By year 2026, we're going to be spending $5.7 trillion in this country to healthcare. Okay? As I mentioned, most of these diseases are completely reversible and preventable through diet and lifestyle changes. Okay? 70% of the Western world, 70% of the death is related to chronic disease. Okay? And 90% of type 2 diabetes is preventable. 90%. 90% of the heart disease is preventable. Okay? And 70% of the cancers are preventable. So this is why I always say, some of you who know me, I said, health is a complete choice. You choose to have good health. Okay? Heart attack, if you have it, I'm sorry, but you chose to have the heart attack. Okay? Same thing with diabetes. You chose to have diabetes. Okay? Many of you don't know, but hopefully after this talk today, you will know and you will make the right changes in your life. Okay? So this is a slide that's demonstrating all the different reasons people die. Okay? Number one being heart disease, and number two being cancer. Look at how big the circle is, right? When you turn on the TV every night, what do you see? You see terrorism, you see war, right? You see murder. Death from those events are small, micro compared to the death of Americans every single day from heart disease, cancer, respiratory disease, and all the other chronic disease. But you don't really see them on the news, right? So this is the top 10 cause of death in US and back in 2016. Again, number one being the heart disease, number two, cancer. Of this top 10, except for the accidents, every single one of them can be prevented, suspended, or even be reversed. But also, what you don't see is this, okay? True number three, third reason why people die is the medical error. Because you go to the hospital, you go to the doctors, and they make the error, but nobody talks about it. But if you turn off the faucet and take care of your own health, you won't need me. You don't need doctors. You won't need hospitals. So this top number three cause of death will be abolished. Okay? These are the risks of why leading to the death around the world and especially this country. Okay? Smoking, high blood pressure, high cholesterol, obesity, and low fruits and vegetable intake, and then physical inactivity. Every single one of them is a diet and lifestyle choice. Okay? So all these risk factors can be reversed, and you can reverse the chronic disease. Okay? So number one and number five cause of death is related to the cardiovascular disease. As I mentioned, 1 in 4 deaths in US is from the heart disease. So that's one death due to cardiovascular disease every 40 seconds. Okay? 800,000 deaths every single year in US is due to cardiovascular disease. And there's nearly about 800,000 heart attacks every single year in US. Okay? That's one heart attack every 30 seconds. And also one stroke every 40 seconds in this country. So by the time I'm done with this presentation, there'll be about 90 people who would have died from cardiovascular disease in this country. Just think about that number. These are completely preventable deaths. Okay? How about cancer? Okay? This year alone, over 1.7 million people will be diagnosed with cancer. Okay? All different kinds of cancers. Okay? 600,000 deaths from cancer this year. Okay? As I mentioned, 2 out of 5 Americans will be diagnosed with cancer during their lifetime. Number 7 is diabetes, but also diabetes leads to many other chronic diseases. Okay? But 70% of Americans now are either overweight or obese. Okay? That's over BMI of 25 or 30. And an additional 8% are extremely obese. So nearly 80% of the Americans are either overweight, obese, or extremely obese, okay? Which leads to a lot of the chronic disease, such as diabetes. As I mentioned, 50% of the Americans will be diabetic or pre-diabetic in about a year or so. Okay? Diabetes leads you to amputation, blindness, kidney disease, so you need dialysis. You need to be hooked up to a machine 3 or 4 times a week. Okay? Heart attack and stroke, which all these can be avoided. So this is a picture of my 25th year reunion, my high school buddies. And some of them, not me, but some of them were the elite athletes, okay, during the high school days. But they reflect the the typical statistics of Americans, 80% of being overweight, obese, or severely obese. And believe it or not, this was me 4 or 5 years ago. Okay? It's a little embarrassing to show this picture, but I myself was overweight, borderline overweight, okay, with high triglyceride and high LDL. One day, I'm a surgeon, so I wear scrubs all day long, so I don't really know how big my belly's getting. And one day I couldn't fit into a suit when I had to wear a suit. That was a crisis. Okay? But also, I do minimally invasive surgery, so I am exposed to radiation every single day. So I'm stuck between two intraoperative X-ray machines getting radiated every day. Okay, that's me right there. So I needed to find a way to make sure that I don't become a victim of cancer like a lot of my colleagues and some of my mentors who were there before me who passed away with cancer. So with research, then I realized, learning how to prevent cancer for myself, realized that standard American diet, okay, we're in sad state of health. Standard American diet that leads you to obesity, heart disease, cancer, diabetes, and majority of the chronic disease. This is what Americans are eating. Okay? 53% of your calories are coming from processed food, okay? 32% from the animal products, and only 11% from fruits and vegetables, okay, which will help you fight off the disease. But of that 11%, 50% of that comes from French fries and ketchup. Come on! Okay? Ketchup is considered vegetable in this country. Something's wrong with that, right? Even you know that's wrong. Okay? Let's look at the trend of America. Okay? So numbers are not as important, but this is from 1960s, okay, to today, and this is projecting to 2030. Look at the trend of obesity in this country. Look at the trend of diabetes in this country. Look at the trend of cancer rate in this country from 1900s to 2005. Okay? How about lupus, autoimmune disease? Early 1900s, there were no such a thing as autoimmune disease. Okay? Not just lupus, but look at all the other autoimmune disease. Allergies, asthma, multiple sclerosis, Crohn's disease, irritable bowel syndrome, ulcerative colitis. The list goes on and on and on. This is, you're not born with this. Okay? You cause this yourself because you didn't realize how to prevent it. Okay? Now look at the trend of what Americans are eating. Okay? So average Americans are eating over 225 pounds of meat every single year. That's a lot. Right? How about chicken? Okay? Look at the incline of this graph. 2018, over 92.5 pounds of chickens are consumed per person in America. Okay? Super Bowl year, this year, 1.35 billion wings were eaten by Americans. Holy moly. Okay? How about cheese? Who loves cheese here? Hey, hopefully not, only very few of you. Thank goodness, right? But over 40 pounds of cheese are consumed per person in this year, in this country. And majority of it is saturated fat and filled with salt. And then you're addicted to cheese is because one of the byproduct is casomorphine. Okay? It's an opiate byproduct. That's why you're addicted. Like you can get addicted to hydrocodone or other narcotic medications. Okay? Sadly, 150 billion, okay, not million, billion animals are killed every year to feed the world. But more than 1/3 of it, 59 billion animals are killed to feed the Americans. Okay? And 1.2 billion farmed animals are killed every single week. Billions. Okay? And did you know that 80% of the antibiotics that's produced in this country are produced to feed the farm animals? And that's what people are eating. That's why this is a part of the reason why the antibiotic resistant bacteria is so rampant. Our body, we're not designed to be eating meat. Okay? We're not carnivores. Okay? Unless you're Dracula, you are not born with a big fang. Okay? Check yourself, check your tooth. Okay? And then we are designed so that our jaw is designed so we're supposed to grind the food because we're supposed to be eating the plant. Okay? Carnivores, right? Their jaw only moves up and down. They grab, bite, and swallow. And then their stomach is so much more acidic than ours, so it helps them digest the meat. Okay? Also, their intestine is only 2 times their body length, versus human beings is 9 times their body length. Okay? Because plants, it takes a lot longer to digest. So our body is designed to be eating plants. This graph shows that population around the world, the one who consumes most amount of unrefined food has the least amount of death that arises from heart disease and cancer. Look at America. Look at Hungary. They must be really hungry for meat, right? And they're dying. 92% of their people are dying from cancer and heart disease. I study longevity also, because I want to live until at least I'm minimum 100 years old. Human beings have the ability to live until about 120. Okay? But when you look at the blue zones, there are 5 cities across the continents. Okay? Okinawa, Acaria, Greece, okay? Sardinia, Italy, Nicoya, Costa Rica, and Loma Linda, California. All these cities have common theme. 95 to 98% of their diet comes from plant. They're plant-based. Okay? This is what happens to you when you develop heart disease. Okay? To your left is normal-looking heart artery. Okay? It's wide open. It's patent. Blood is freely flowing through. The one on the right is atherosclerosis. Okay? The kids between age 10 and 12. What percentage of you do you think they already have atherosclerosis? Okay. What percentage? 25. Okay. 65% of the kids between age 10 and 12 have early signs of atherosclerosis. An additional 8% have more advanced form of atherosclerosis. Okay? That's 72% of the kids with some form of atherosclerosis already. Okay? So World Heart Federation, okay, stated that person eating a diet low in saturated fat, which is highest in animal fat, right, with plenty of fruits and vegetables, has 73% risk reduction for new major cardiac events compared to someone eating Western style diet. Okay? Epic Oxford study. This study had followed over 45,000 people for 12 years. Okay? Vegans and vegetarians were less likely to develop heart disease than health conscientious meat eaters. Not talking about people who are not healthy, talking about health conscientious meat eaters or even fish eaters. A lot of people think that eating fish is going to give them heart health. But there were less vegans and vegetarians who were less likely to develop heart disease by 32%. The Adventist study, looking at over 73,000 people. Adventists are very health conscientious people also. So vegans compared to non-vegans, men had 42% less cardiovascular disease and 55% less ischemic heart disease. Let me tell you about Dr. Crow. Dr. Crow is chief of breast surgery at Cleveland Clinic. Some of you may know that Cleveland Clinic has one of the best heart programs in the world, okay? And he was one of the chief surgeons there. After a long day of doing surgery in recovery room, while he's writing orders, he suddenly had a massive heart attack. If he was at his home, he would have been dead, okay? But they quickly rushed him to a cath lab and tried to revive him. He died 3 separate times, but they were able to revive him. But on the left, you'll see that his heart vessel, main vessel called LID, is completely blocked. And to a point, it was so bad, they couldn't do a stent or even do a bypass surgery at Cleveland Clinic. So they revived him, but they told him that, you know what, only thing we could do is medically manage you. That's death sentence. So he was so depressed and just kept his head down until Dr. Caldwell Esselstyn, one of the pioneers for the plant-based nutrition, came up to him and said, hey, you have absolutely nothing to lose, so why don't you try whole food plant-based? And he did, religiously, for 2.5 years. And this is what it looked like. He completely reversed his heart disease. His vessel looked like it had never had the. Dr. Dean Onish, who's originally from Dallas, now he's at University of California, San Francisco, also did a study and found a similar thing. With diet and lifestyle change, with low-fat vegan diet, you can actually reverse the heart disease. The bottom left, where you see the blue area in the heart, it shows that blood is not flowing to that region of the heart. Okay? But after going through diet and lifestyle change, you'll see the picture on the right, that blue is almost gone and it's orange and red again. Okay? The heart disease is being reversed. Some of the risk factors that you saw early on with the big circles, one of them is the BMI, obesity. Okay? So looking at the Adventist health study, there are again group of people, the Adventists, the religion encouraged them to live a very healthy lifestyle. Even their meat eaters, they tend to eat significantly less than standard American diet. Okay? Even within this group, the only one who had normal body mass index were the vegans. Okay? Everyone else were overweight or obese. Okay? Another risk factor is the cholesterol, your blood lipids. Okay? Vegans had by far the lowest total cholesterol, LDL, and triglyceride. Only group that had within normal range. So you can make yourself heart attack proof. Okay? You can make yourself heart attack proof by having total cholesterol below 150. Your doctors may tell you that if it's below 200, you're in a normal range. Normal range by what standard? Okay? In my mind, normal range is where I know that I'm not going to have a heart attack. So I want my total cholesterol to be 150. So if you had a cholesterol check, go back home and check the lab result. See if it's below 150. Because if it's above 150, then you're still at a risk. And LDL, you want to be between 50 and 70. Okay? At that range, you're almost heart attack proof. Hypertension is another risk factor. Okay? So when they compare the omnivores, meat eaters, with the vegans, vegans had 72% lower risk of developing hypertension, and vegetarians 55%. Inflammation, and I say inflammation is the root cause of most of the chronic disease. Okay? The low-grade chronic inflammation increases the metabolic abnormalities associated with the cardiovascular disease, and it accelerates your atherosclerosis formation. Okay? So this study in 2007 showed, compared to CRP, this is a way to measure your chronic inflammation in your system. So they measured the vegans. Okay? They didn't distinguish healthy vegans versus non-healthy vegans, but the vegans versus endurance athletes and people who are eating Western diet. And the normal range is 1 or below. Okay? So endurance athletes had about 0.75. They're the guys, crazy guys, running 50 miles a day, or some crazy marathons. And theirs is 0.75. The vegans were even lower than that, 0.57 of CRP rate. Standard American diet folks at 2.61. Their body is just constantly inflamed. And in the future, you'll hear a lot more about what they call TMAO. It's trimethylamine oxide. Okay? So TMAO is also a substance that in your system, if you develop it, you develop accelerated rate of atherosclerosis, heart disease, and many other diseases, even including cancer. So if you have a heart failure, already have some form of a heart disease, and you have high level of TMAO, your risk of dying increases by 3.5 times. Not 3.5%, but 3.4 times. Okay? But this TMAO, it gets produced in your gut by the gut bacteria. Okay? So this bacteria is carried by the only omnivores, people who eat meat. Okay? If you're a meat eater, you carry the bacteria that produces trimethylamine that gets oxidized in your liver. Okay? Vegans do not carry that in their colon. Okay? So if somebody vegan accidentally happened to eat a meat, they don't necessarily produce a TMAO causing accelerated inflammation in their system. But if you're a meat eater, you carry the bacteria that produces the trimethylamine. And these three guys in year 1998 won a Nobel Prize for discovering something called nitric oxide. This is another reason why healthy vegans do not have heart disease, chronic disease, cancer, and many other forms of chronic disease. Okay? Nitric oxide allows your blood vessels to dilate, okay? So that more blood can be flowing. And it also stimulates what they call progenitor cells. If there are stem cells inside your blood vessels so that they could repair themselves. But it helps stimulate the production and activation of other forms of stem cells in your body so that you can actually repair and regenerate yourself. Okay? It also prevents the arterial blockage, and then also a promotion of migration of the smooth muscle cells, which forms a big plaque, the slide you saw earlier on. Okay? The next topic is the cancer. Okay? I can tell you that except for some infants here, every single one of you have cancer cells in your body. And your body is fighting, your immune system is every single day fighting those cancer cells. Okay? But if one cancer cell escapes the immune system, that 1 becomes 2, 2 becomes 4, 4 becomes 8. Okay? But it takes years and years and years, near 10 to 20 years, for it to even become detectable. Okay? For it to be detectable. So when somebody says, when doctor tells you need to go get a mammogram for early detection, if you can detect it, it's already late detection. Okay? You got to prevent it much earlier than that. Okay? Then the tumor cells, if it escapes your immune system, then it sends a signal so that the blood vessels will grow onto those tumor cells. That's how it grows and grows and grows. And then that's how it also spreads. That's called metastasis. These all can be prevented. So this organization, World Cancer Research Fund, and along with the American Institute for Cancer Research, there are over 100 scientists and that made up from 30 different countries. And annually they produce something called Food, Nutrition, Physical Activity, Prevention of Cancer, Global Perspective. And they said, in order to avoid cancer, prevent cancer, you got to eat mostly plant origin, okay? And limit your intake of red meat and avoid processed meat. It breaks my heart when I go somewhere for breakfast, okay? I see parents feeding their kids bacon, okay? Which is a processed food, okay? World Health Organization, okay, has categorized the processed meat as group 1 carcinogen. That means it will cause you cancer. It will. Okay? If you eat enough of it, it will cause cancer. Some of the other substances that are category 1 are plutonium, asbestos. Right? You don't want to go into an old building that's filled with asbestos because you know you're going to get cancer. Right? Cigarette, they're category 1. So if you're giving your child a bacon or any other form of processed meat, pepperoni, salami, right? You might as well give them cigarette, because you're going to give them group 1 carcinogens. And red meat is considered 2A, which means it probably will cause cancer. And I mentioned this before, trimethylamine. Okay? It's in all forms of animal products. Okay? Whether it's meat, whether it's egg, whether it's fish. Okay? When you consume them, it produces, your gut bacteria produces the trimethylamine in your colon. Okay? But trimethylamine not only causes the inflammation, but also it becomes something called nitrosamine, okay, which is filled in the processed food also. And these are carcinogenic. Okay? Also, any kind of animal protein, the meat, if you cook them in high temperature, because most of the time, you're not going to eat them raw, right? You're cooking them in a high temperature. They're going to form something called heterocyclic amine, which is also carcinogenic. Again, means causing cancer. And all forms of animal products causes you to develop more insulin-like growth factor 1. Okay? You need IGF-1 when you're a little baby so that you can grow. Okay? milk has a significant amount of, produces significant amount of insulin-like growth factor, because you're trying to get 50-pound calf into a 500 calf in the span of 6 months. If you're an adult, you're not growing anymore, right? So what else has to grow? Cancer cells. Okay? That's why as you grow older, you want to limit the amount of insulin-like growth factor in your system. But animal proteins is going to stimulate the production of it. And there are so many other studies, but this is one of them. The China study by Dr. Colin Campbell. It's a great book produced by the pioneer of the plant-based nutrition, showed a strong association of the animal food with cancer. And this was done a long, long time ago. Okay? But he also showed that blood cholesterol not only causes the heart disease, but it also was a very strong predictor for cancer risk as well. So by lowering the cholesterol, you're not only reducing the risk of heart disease, but you're also reducing the risk of many forms of cancer, such as liver, rectum, colon, lung, breast, stomach, and esophagus cancer. Okay? And also brain cancer as well. The breast cancer is one of the most common cancer that women face, right? 12% of American women will be diagnosed with cancer sometime in their lifetime. That's 1 in 8 US women. Okay? Over 300,000 women die every single year from cancer. Doesn't have to be. This study showed that looking at 1,500 breast cancer patients, if they eat greater than 5+ servings of fruits and vegetables, okay, and then have a moderate amount of exercise every day, that's walking 30 minutes a day, they significantly decrease the risk of death. Okay? And so many people are so afraid of soy. I've heard the other day, one of my employees, they said to her, unfortunately, her mother was diagnosed with cancer. She gave me permission to talk about it. And her oncologist told her to avoid soy products. That is the news from 1970s, when people were just frankly ignorant and didn't know much about the research of soy. Okay? Soy products will actually help you prevent and reverse cancer. So it's something that I consume almost every single day. The more you consume, up to about 5 servings per day, you will prevent and also reverse breast cancer, but also in a few slides I'll show you how it also reverses the prostate cancer as well. And prostate cancer is the most common cancer for men. Okay? 1 in 7 men will be diagnosed with prostate cancer during their lifetime, and 164,000 new diagnoses of prostate cancer every single year. But how many of you know who had some form of treatment for prostate cancer by taking out the prostate that makes them incontinent and impotent? But the research shows that only 1 out of 49 people who have the traditional treatment for prostate cancer actually lives longer. If it's only 1 out of 49, why am I taking out my prostate and becoming incontinent and then impotent? Right? I want that function until the day I die. Right? Yeah. Yeah. That's what my wife said too. But these people did not change their diet and lifestyle. Okay? Even people with heart attack, the risk factor doesn't change after stent or bypass surgery, is because simply they don't change their lifestyle. And some of you who's been to our free seminars before, I've shared with people that one of my patients who had a heart attack and was consulted with the cardiologist the night before, I show up to a rounding in the morning, and then he's eating bacon and scrambled eggs and milk, whole milk, the next morning. Okay? It's travesty. And people even some of the cardiologists just don't have the knowledge. It's not just about bypass or stent or other medications. Okay? So Dr. Dean Ornish, after he got done with the heart disease studies, then he tackled the prostate cancer. So he got all these people who refused to have any kind of treatment, and these people, patients who had low to moderate grade of prostate cancer. Okay, 49 of them had traditional type of a diet. They just continued on their usual diet. 44% agreed to go on to a low fat vegan diet and lifestyle change. Okay? So the one who stayed with the usual diet, their PSA, so a form of measuring your degree of prostate cancer, got elevated in the span of 1 year from 6.3 to 6.7. It was continuously getting worse. Okay? Versus men who changed their diet and lifestyle, their PSA dropped from 6.3 to 5.8. So they were actually, with diet and lifestyle, they were reversing the prostate cancer. And no one, not a single one of them, required further treatment after that. So then he looked at the people with the advanced prostate cancer. What happens to them? Okay? So these are the people who already had previously surgery. They took out their prostate, but then years later, there was a recurrence. Prostate cancer came back. They were the advanced prostate cancer patients. So he looked at their survival rate. Okay? The one who changed their lifestyle and diet and did the low-fat vegan diet, they lived additional 19 years. 19 years. So probably their normal lifespan. Versus the one who kept up with the usual standard American diet, eating their hamburgers, eating their cheese, their lifespan was only 6 additional years. That's a huge difference. So would you rather be that 6-year group or the 19-year group? It's a choice you have to make, right? Die early by eating your hamburgers and cheese, then you will be in that 6-year category. Versus if you want to live longer, see your kids, grandkids grow up, then you're going to change your diet and lifestyle. But he also showed this. A lot of people say, well, it's in my family gene. You know, my grandparents, my parents, and my uncle, they all had heart disease, they all had cancer, so that's my destiny, right? But we say the genes loads a gun and you pull the trigger. Okay? And Dr. Dean Onish showed this in his study. Okay? He was able to demonstrate, after only changing the diet and lifestyle for 3 months, he was able to turn off the genes that causes cancer. It's called oncogenes. Over 500 genes that causes cancer were turned off after only 3 months of changing their diet and lifestyle. Okay? And then there were additional 50 genes that protect you from cancer were turned on. It's called epigenetics. So through diet and lifestyle, you can actually change your gene expression. Just because you have the genes does not mean you have to have cancer. It goes back to soy also. Not only the soy, but also plant-based nutrition. Okay? This showed that people who consume most amount of soy, okay, prevented developing prostate cancer, reduced their risk, and also if you had prostate cancer, it prevented recurrence. Okay? So I recommend everyone to consume soy products. And I don't want to leave out the colorectal cancer. I didn't want this talk to be a 3-hour talk. So, but the American Institute for Cancer Research also stated that 45% of the colorectal cancer can be prevented if we all ate more fiber, okay, and ate less meat, drank less alcohol, and then exercise just a little bit. Okay? So only you have that control, right? You decide what you put in your mouth. You decide whether you're going to exercise or not. Okay? Next topic is the diabetes. I think most people have misconception about what type 2 diabetes is. Everyone is so fixated on the blood sugar, right? Even the family practice doctors and internists, everyone's goal is to lower your blood sugar. But that's the after effect. Okay? Type 2 diabetes is really the disease of insulin resistance. How it functions is if you eat any kind of carb or even protein or even fat, your body releases the insulin. Okay? Insulin is like a key. It goes up to the cell, especially the skeletal muscle and liver cells and all the other cells, and knocks on the door and then tries to open the lock. Okay? And then the door opens, then the blood sugar rushes into the cell. Okay? But if you have so much fat inside your cell, it mucks up the key. Okay? So that insulin cannot get into the lock, and it can't open the door. Okay? So blood sugar is staying out in the bloodstream. That's why your blood sugar elevates. That's insulin resistance. Okay? So doctors, of course, have to call this fancy and give it a fancy word. You can't say fat in the cell. So the official term is intramyocellular lipids. All that means is that they're fat inside your muscle tissues. Okay? So with the fat, it prevents the glucose from coming into the skeletal muscle and to your liver cells. Then your blood sugar elevates. Okay? Going back to the Advantage Health Study. Okay? So I mentioned that the vegans were the only group that had the normal body mass index. Okay? But also they had the lowest prevalence of type 2 diabetes among any group. Okay? Also, this study showed that eating, this is done at Harvard, looking at the Harvard nurses, over 150,000 of them. Okay? And they followed them for 4 years. And it showed that the one who ate greater than half a serving of red meat, that's 1.5 ounce, okay? Half a serving of red meat daily increased the risk of developing type 2 diabetes by 48%. Okay? There's studies after studies after studies. But what if you have type 2 diabetes already? Okay? Type 2 diabetes is mostly completely reversible. Again, this is your choice. Okay? So PCRM, Physician Committee for Responsible Medicine, took on challenge of comparing low-fat vegan diet with American Diabetic Association diet. So if you have diabetes, chances are your doctors are recommending you to eat what is being recommended and follow the guidelines of American Diabetic Association diet. Okay? They have to be what they call politically correct because they accept, they're not-for-profit and they accept a lot of funding from a lot of different corporate organizations. So they can't really state what is completely true, which is really sad. Right? So this study showed that you measure the state of your diabetes by measuring hemoglobin A1C. The low-fat vegan diet significantly beat out American Diabetic Association diet. People improved and actually reversed. American Diabetic Association guideline only managed the diabetes versus low-fat vegan diet actually reversed the diabetes. Okay? But they also looked at the LDL cholesterol, which is the bad cholesterol. Okay? American Diabetic Association diet lowered the bad cholesterol only by about 9%, versus the low-fat vegan diet decreased the LDL cholesterol by over 21%. So not only you reduce the risk and reverse the diabetes, but also you reverse the cholesterol, therefore you're reversing and reducing the risk of heart disease and cancer. I'm going to share with you some of the patients. Well, technically I guess they're not my patients because they are the people who attended the free seminars and did it on their own, just like every one of you here. But Rita decided to take control of her life, finally. She's an insulin-dependent type 2 diabetic, which is the worst kind of diabetes, right? Except for type 1 diabetes, for 13 years. Her A1C, hemoglobin A1C was 12.5, that's off the chart. Okay? Her fasting glucose was 280, that's off the chart. Her LDL, they couldn't even get the number because it was so off the chart. And she attended, and she was on 2 different forms of insulin, and then 3 different forms of oral diabetic medications. It was really bad. So she finally decided to try this 100%, whole food, plant-based vegan diet. It only took her 10 days. She's been taking insulin for 13 years. It only took her 10 days to come off the insulin completely. Okay? And her fasting glucose was within 70s, okay? 72 to 84. Okay? And then within 2 weeks, she cut her oral diabetic medication by 50%. By week 7, she came off of all her medication. Every single one of them. The one she's been taking for 13 years. Bobby, he works with us in the operating room. August 2016, he had a massive heart attack. So they took him to the cath room, and then they were able to place a stent. And then afterwards, the cardiologist told him, eat better, okay? Don't eat fried food, reduce your sodium, and don't drink soda. That was it. So then he discovered the plant-based diet, and after only about a year later, he lost 70 pounds, was in great health. When he went back to the cardiologist told him that he didn't even look like he ever had a heart attack. Okay? And Denise, it's not just heart disease, it's not just diabetes. Denise suffered from rheumatoid arthritis. It's so bad that she was even on the chemotherapy. And then her doctor finally put on the Humira. You've probably seen the Humira commercial because it's on every other commercial. They're making $gazillion because every single autoimmune disease is being treated with Humira these days. I think it's like $25,000 per person. Okay? But one of the side effects is heart failure. And she started having heart symptoms, so she discontinued it. So in December 2017, she came to seminars like this, and then January, she went 100% whole food plant-based. Okay? So it took her only 2 months for her rheumatoid arthritis to be in remission. Okay? She's been on chemotherapy and Humira for years. And then 4 months, took her 4 months where her rheumatoid factors were gone. That's basically saying her rheumatoid arthritis has been reversed. Arthur, who suffered from obesity, type 2 diabetes, fatty liver disease, and also high cholesterol. He himself underwent whole food, plant-based nutrition, and he lost in a span of a year, I think it was much less than a year, lost 50 pounds, reversed all his chronic disease, diabetes, fatty liver disease, high cholesterol, and he's no longer on any medications. This can be every single one of you. So what is a diet that reverses heart disease, cancer, diabetes, strokes, and many other chronic disease? That helps you not only lose weight, it's not about the weight, but it helps you lose weight and also keep it off, because this is a lifestyle change, and live longer. But who cares if you're living longer, just stuck in a nursing home, don't even know the names of your kids, right? But living healthier, okay? And living younger. It's a whole food, best nutrition out there. Okay? This is not a fad diet. This is a whole food, plant-based, vegan nutrition. And there's a whole list of all the other disease that you can repair. Guys, listen up, including erectile dysfunction. Okay? You don't need that blue pill anymore. Okay? Because the erectile dysfunction is a first sign that you have cardiovascular disease. It's because the blood vessel is clogged. The blood is not flowing down there. That's why you have erectile dysfunction. Okay? That's also how they discovered the blue pill in the first place. Okay? Because it was originally designed for hypertension. Okay? And these guys were coming into the clinic, the research center, their blood pressure was lower, but they had headache, but something else was moving down there. Okay? That's how they discovered the Viagra. Okay? So what is whole food plant-based nutrition? It's whole, unrefined, or minimally refined plant food. Okay? You gotta think fiber. Any food that has fiber. Okay? And these are what I consume every single day. 4 servings of fruit, 5 servings of vegetables, and even within that, you'll hear me talking about dark green leafy vegetables, at least 3 servings of dark green leafy vegetables, and 2 other servings of vegetables, 3 servings of whole grains, not white rice, but quinoa, amaranth, millet, barley, brown rice, and legumes and beans, 3 servings of that every day, and nuts and seeds. Every single city in blue zones, they consume significant amount of beans, every single one of them. Whether they're in Japan, whether they're in Costa Rica, whether they're in Italy, whether they're in Loma Linda, California, or in Greece. Every single one of them, that was a common factor. They consume beans, okay? Nuts and seeds, and fiber. It's next to impossible really to consume about 100 grams of fiber if you live in America, because all our food is so diluted, but that should be our goal, okay? But average Americans are consuming only about 10 to 15 grams of fiber every single day. Okay? Also think about spices, turmeric, ginger, garlic, onion, coriander, cumin, all those type of things. They're very anti-inflammatory, antioxidant, okay? And also you gotta consume a lot of water. These are the things that you gotta avoid. Any kind of animal products, yes, including dairy, which is extremely inflammatory, and eggs. Okay? That means also cheese as well. Okay? Processed oil. Get this question all the time. Are oils healthy? Is there such a thing as healthy oil? I'm sorry, if you're trying to reverse the disease, there's no such a thing as healthy oil. Okay? Is one healthier than the others? Maybe. However, it's pure fat. Okay? And also, it leads you down to inflammation, every single one of them. Okay? So there's no such a thing as healthy oil. And refined grains, like white rice, refined sugar, okay? Refined carbs, simple carbs, bad. Okay? Some people think that the vegans or plant-based nutrition vegans eat just a lot of carbs. That's a very broad term, right? We don't sit there and eat sugar all day long. Sugar is bad, okay? But it's the complex carbohydrate is what I'm talking about when I'm talking about fruits and vegetables and beans and legumes, okay? And reduce your cholesterol. Only animal products produce cholesterol. No plant food produces cholesterol. And saturated fat, limit that. Okay, say no to it. So eat like eating rainbows. Eat the food that has a lot of color, because the food with color has a lot of antioxidants. But I get this question all the time. I'm sure if you guys are vegan or vegetarian, it's the most common question: how do you get your protein, right? I worked in a hospital for more than, I guess it's now 19 years. Okay? Not counting the medical school. I've never seen a single patient being admitted in this country because somebody is deficient of protein. Okay? Everyone is deficient of fiber. That's why some of you go to the bathroom only once a week. That is sick. Should be going 3 or 4 times a day. You know, in our plant-based startup kits, everyone gets a toilet paper because you're gonna need it. Okay? And everyone thinks this is vegan, okay? You know, not to make fun of him, but this is the image of vegan, and that's not the case. The biggest animals around the world are vegans, okay? These animals also, they're all vegans, 100% vegans. Some of the strongest men in the world, okay? I don't think they're deficient of any kind of protein. Derek Morgan, he's one guy, and he and his wife single-handedly converted 1/3 of Tennessee Titan football players, NFL professional players, to become vegans. Right? That year, they made a playoff for the first time in many, many years. Because even the guys who were making fun of Derek said, "Man, how are you gonna, play professional football just eating plant food?" Well, that guy started noticing Derek was running faster, he was recovering faster, he was getting stronger. So he himself also changed and became vegan. Okay? So let's compare red beef and bean. 100 grams of beef versus 100 grams of beans. Okay? They have the same amount of protein. Both of them have 22 grams of protein. Okay? But the bean has 15 grams of fiber. Okay? But also has more iron, more calcium, more magnesium than beef. But it also doesn't have any cholesterol. Also, it's a heck of a lot cheaper. Yeah, I don't know how this happened, but so I live my life through what I call paired lifestyle, okay, to achieve the optimal health. Okay, that's plant-based nutrition, exercise, moderate exercise. Okay? You don't have to do a hardcore, high-intensity exercise to live long. Okay? That's okay if you want to do it, but just mild to moderate exercise every single day will make a huge impact. Okay? Avoid toxins, and biggest toxin is food, but also things like plastics and some of the chemicals around your house, and then also restore stress management, sleep, family, love, sense of community. These were all the common themes of the 5 cities in the blue zones. Okay? But some of you may ask, is there a side effect to eating whole food plant-based nutrition? There may be. Because you may lose a lot of weight and you may be tempted to wear skinny jeans. Okay? But I advise you not to do that. Okay? But I shared this cartoon with people on many talks. These cows are being led to the slaughterhouse. Okay? And it says, my only consolation is that by eating us, they're killing themselves. Okay? And which is 100% true. Okay? There may be such a thing as karma. So I say health is a choice. You have a complete control of your destiny, of your health. Okay? Heart attack is a choice. I'm sorry, it may sound harsh, But after talk, every single one of you who had this, I know some of you here had a heart attack before, okay? But it's your doing. You did it to yourself. But the good thing is that you can prevent it if you haven't had it. You can reverse it if you have the heart disease. Diabetes is the same thing. You're doing it to yourself. You can actually reverse it, okay? And all the other chronic disease, majority of disease, can be reversed, okay? So what's your choice? What are you gonna do after this talk, okay? This was me, but I made a decision to live 100% whole food, plant-based nutrition lifestyle, okay? And I'm stronger and feel younger and healthier than when I was in high school, okay? I weigh less now than I did in high school. So I recommend to everyone whole food, plant-based, vegan nutrition, and I tell this to my patient every single day. And the one, I see it, the one who makes the change recover much faster and they feel so much better. And some of them who needed spine surgery comes back to me and say, Doc, I don't need you anymore. Okay? That's great. So I'm trying to put myself out of business by making sure that people can fix themselves without surgery. Okay? So also, by this method, this lifestyle, you're going to be developing a kinder world for the animals. Okay? And also, you're going to develop a more sustainable planet that for your kids, your grandkids, and your grandkids can live. So I host, along with a few others, a monthly seminar, okay, with the Whole Green Living. The next topic is once a month or sometimes twice a month. The next talk is in November 10th, 11 a.m. Normally it's 10:30, but they asked us to move it to 11 a.m. It's completely free, and it's at Treehouse, Dallas. The next topic is losing weight without counting calories. Because one of the beautiful things is you can eat as much as you want. Some of you who follow me in social media, I see how much I eat. I eat a lot because I love food. I have this disease called seafood diet. If I see it, I gotta eat it. Okay? And I love food, and my wife makes a wonderful whole food vegan diet, doesn't cook with oil, uses a lot of spice, and so I can't help myself. Okay? And also we have a reversal program. If you need more help than just the seminar, now we started the reversal program of diabetes, heart disease, hypertension, weight loss, and many other diseases. The amazing thing is that there's one solution for all these diseases. It's the whole food, plant-based, vegan diet. Okay? And here's the email that if you want to inquire about it, you can send us an email. And you can follow us on the Facebook, and we have a Facebook closed group. And you can share recipes and ask questions about recipes, and then ask medical questions. I myself answer questions along with all the other members. We have above 880 members now. Okay, they're not just people from Dallas, but people from all over the world. Okay? And it's continuing to grow. But we only have simple rule: be positive and be nice. Okay, because if you're not nice and compassionate, you will be kicked out of the group. Okay. And this is some of the social media. If you want to follow us, Whole Green Living, at Facebook, Instagram, and Twitter. Our website's still being developed. And then this is my social media, pretty involved. So feel free to follow me. It's Dr. Wong, MD. And if you have questions, then you can direct message me or message me through the social media, and I'll do my best to answer every single one of you. And this is where you can find me and some of my other website. Okay, so. I know we're running behind, but if some of you have questions, I'll entertain a few questions. But thank you so much for coming. And this is such an amazing event. So I wanted to thank Texas Veggie Fair, the best Veggie Fair in state of Texas and the largest fair. So I really thank them for putting something together like this to share with people from our community. So